I have been a hospice volunteer for a little over a year, and I came to BJC because I actually knew a therapist, a social worker, who actually works at BJC Hospice. Usually going in and helping out a caregiver so that they can go out and go to the store, or just go and get their hair cut, just go and do simple things that we all really take for granted. And I find that thinking of one patient in particular, when I went in there, her daughter was very worried about leaving her mom. And I said, you know, she's in good hands, don't worry, I'll take care of her for you. And she was nervous about leaving her because she was her caregiver probably 99% of the time. And so I think that people have a tendency to feel guilty, or they feel a little bit like, ooh, mom or dad or whomever won't really be taken care of as well as I could take care of them, that there's a little bit of apprehension on their part. And I think that by coming back weekly or several times a week, however often they need that, they get to understand that this is really good for them as well. It's good for them because it helps to recharge their batteries, to just be able to get out of the house and go do something very basic, to know that there's someone there who will take care of their loved one in their absence. Probably my favorite thing is actually the interaction that I can actually have with the patient or even the patient's family. I had one patient in particular who was comatose the entire time that I worked with her, and I had a lot of interaction with her daughter, and just kind of helping them going through the grieving process even before her mom was gone, to just be a sounding board for her so that she could actually talk about the things that were on her mind. And I know that she found that same sort of help with her social worker through BJC Hospice that she had through BJC Hospice. And so I think it's that sort of thing. It's actually the interaction with the patients and their families is probably the thing that I like the most about working with BJC Hospice. If they needed to discuss things, and oftentimes people want to discuss things with you that perhaps they might not want to discuss with their family because they're afraid that their families don't want to hear what they might have to say if it's in regards to their passing. So I think that in that sense, I did feel qualified to be able to go in and work with people as opposed to being a nurse or a doctor or someone of that caliber. They may be leery at first about committing to hospice because for them that means that the end is near. But I think that once that we come into their homes, they're grateful because they're getting some relief in the caregiving. They're getting support. They're getting someone that they can speak to, that they can share their fears with. And through all the people that work at BJC Hospice, they have the opportunity to offer the support in any form, whether it be the nursing, the doctors, the social workers, the volunteers, can really offer them the support that perhaps they didn't even realize that they needed.
I've never had a job before that I've just felt so satisfied with the results and the responses, and I look forward to it every day, to dealing with the patients and the whole staff at BJC Hospice, and it's been wonderful. I'm glad I'm doing it, and it's amazing to hear people's responses on it, pros and cons. I can't believe you're doing something like that. How could you do something like that? And I always say, why wouldn't I? And each time I get another patient and that patient passes, I feel like I'm just giving back, and I feel very good about that. I think my favorite part of volunteering at hospice is getting involved with the whole organization and just knowing that you are helping people, giving back. I think everybody's so busy nowadays, and we're all doing our own things. Nobody's really thinking of anybody else, and I think that's probably the most rewarding part, is working with other people that really need help and appreciate help. How thoughtful, how caring, I mean, you know, every positive word in the book, which is amazing because you're sitting there thinking, well, I really didn't do anything. And they just make you feel so appreciative. And it just feels very, very good, like a whole person just helping other people. Yet I never wanted to be a nurse, and I never liked babysitting, so I can't, you know, I'm surprised at myself that I enjoy it so much, but I do. A lot of times the patient is so far along they really can't communicate, so I really just sit with them and keep them company. Some patients I do talk with and have conversations with, read to them. We had a little boy that was very sick, and his siblings, his mother thought the siblings weren't getting enough attention. The little boy wanted to be with his mother, so we actually entertained the 2 other little boys while she laid with her sick little boy. So each one is a little bit different. I called the office and they said come in for a training session, and basically the training session was just general information. You didn't have to have any nursing background or any other hospice experience. And a lot of the training was just what to do if certain things happened, who to call, who to contact, and things like that. And how to talk to patients, how to talk to family members. And the training is ongoing, which is nice. They do a lot of different kinds of training as the time goes on, which is nice. Anybody could be a volunteer for BJC Hospice.